Dr. Stephanie Canale, founder of Lactation Lab. Good to meet you.
Nice to meet you.
Stephanie, good to have you here. How's the festival going for you?
Thank you. It's great. It's very busy.
Yes. You having a good afternoon?
Having a great afternoon.
Fantastic. Okay. Founder of Lactation Lab. Walk me through what you're building.
What we have built and continue to build, I'm a family physician at UCLA and the founder of Lactation Lab. I struggled with breastfeeding my second after I went back to maternity leave. I only took 5 weeks off with her. My daughter was what's called failure to thrive, so she was falling off the growth chart with breast milk alone. And that's how it started, and kind of like poked my interest about what is in breast milk. And yes, it's this magical bodily fluid, but it's time to maybe look into it and see what's going on. So we provide breast milk testing. We look at how diet affects milk and what elements actually impact and how we can improve maternal and child health over time.
Interesting. I'm curious, as you went through that journey that was so personal, what surprised you as you started to peel back the market around breast milk?
The most surprising thing is how little research was done with breast milk. The idea of wanting to know what is in breast milk is not new. There was a test that was actually created in 1978, which takes the equivalent of the inner tube of a ballpoint pen, spins it down, and then takes a ruler to measure the fat layer, and then guesses the calories. And people still use that nowadays.
Wow.
So that's really, it sparked my interest about wait a second, moms are different, our diets are different, and looking at a study from 1958 that looked at a small sample pulled together from 3 moms wasn't really enough, so we needed to change that.
Okay, well that's a good segue into talking about what the test really is, what the product really is. So what have you rolled out?
So we're direct to consumer, as well as we have a corporate wellness program. It looks at milk and how diet affects it. So we look at, for example, calories, protein, carbohydrates, vitamin A, C, B12, iron, and heavy metals in breast milk, which we're learning are unfortunately found in a lot of over-the-counter prenatal vitamins. So, yeah.
Direct to consumer is an interesting challenge. I assume, are you going directly to the consumers?
It is a challenge, but it's surprising that so I'm self-funded, bootstrapped today, and most of our users, we have thousands of users that they're just moms who've decided they want to know.
Fantastic.
And I think what we're also providing is for a lot of new moms, when they have a new baby, there's a lot of unknowns. This is one thing they can learn about, one area they can have a lot of control with some actionable tools to really impact their health and their baby's health.
I can remember how important research was when my wife and I were having our 2 children, just how much you wanted to know everything that you could in order to get ready for this unknown.
They say knowledge is power, right?
Yes, yes. So where are you at in the development of the company and the product?
Right. So we launched 2 years ago. We have sales, and now we're looking to connect with payers and scale.
Okay. And that was 2019. Now we're coming to 2020. What are you looking forward to? What are the milestones you specifically want to hit?
Right. So our big ones are looking at 3rd trimester predictors of milk production, postpartum depression, allergen introduction, so just further testing of the milk that hopefully we'll have on the market soon.
Very nice. What's been your experience like at the festival? Why has it been important to be part of a community like this?
For me, it's been really important because, again, I'm still working to bootstrap this company, and it's very hard to reach out to payers. I mean, if you saw the list of people I've met with yesterday, it's impressive. And I wouldn't have been able to do that without StartUp Health.
That is amazing. I know there were more than 2,000 meetings scheduled through the app on the 3rd floor. So you were a percentage of that. You were a few of those.
It felt like I was all 2,000, but I wasn't. It was just amazing. I mean, really big companies, big names, and huge company. I just wouldn't have been able to connect with otherwise.
Yeah, like you said, huge need, not enough innovation happening in this space yet, but you're stepping into it. Love hearing what you're doing. Happy to have you down in the studio, and I hope it's an awesome week for you. So thanks.
Thank you very much.
Thanks for coming and telling us your story.
Thanks so much.
All right.
Thank you.